Well, I know many people are concerned about medical care going forward. Here to talk with us a little bit more this morning about that is Dr. Patel of the Sneeze and Snooze Clinic. Dr. Patel, how are you this morning?
Wonderful, wonderful.
Good. I'm glad you're staying healthy. So, how has COVID-19 impacted the way you see patients?
Well, more and more patients are preferring a telemedicine visit as opposed to getting out of their house and coming to the clinic and being in the exam room and then waiting room, exam room, and being seen that way. And we have been offering telemedicine for last 2-3 years, but nobody wanted it. But now, because of the corona pandemic, we are seeing 10 patients on an average a day via telemedicine.
So for those, it has been around for a little bit, but a lot more people are taking advantage of it now. For those who are still hearing about telemedicine for the first time, what is it and how do patients utilize it?
Right. So for chronic disease management, telemedicine visits are as effective, maybe even more effective than face-to-face visits. And by chronic disease management, I'm referring to congestive heart failure, diabetes, our own sleep apnea that we do a lot of. And that has been shown. There was a 2017 systemic review meta-analysis which showed that patients with congestive heart failure who use telemedicine have reduced hospitalizations, reduced length of stay, and in fact, reduced death rate. So when you give access to patients for chronic disease management, then all these parameters and the health improves.
How easy is it for patients to utilize telemedicine?
That's the concern that most of our patients, especially the seniors, would have. So we have been trying to make it as simple as possible. We have an extensive instructions on our website, snoozeclinic.com/TV for televisit. And there patients can learn about it. And what we are also doing is our staff is well trained to walk people through. So if they give us a call on our clinic receptionist phone number, the receptionist is trained to walk patient through. And the telemedicines are getting easier and easier. People can access the visit from cell phone, from desktop, from laptop. So it's becoming easier.
And how much do you think telemedicine will be used going forward, even after coronavirus?
Ideally, it should be probably upwards of 50%. And my gut feeling is that more and more patients would be using it for routine follow-up care for sleep apnea, diabetes, congestive heart failure, and similar chronic conditions.
So how do you feel the response has been from patients kind of during this crisis, potentially utilizing telemedicine? Do they still feel that same kind of care and concern, maybe not seeing you physically face to face? How is that experience for your patients switching over to telemedicine?
Right. So the first one is confusion, reservation. Will this work? Would I be able to hear Dr. Patel? Would he be able to hear me? Would I be able to answer questions? So that's the first initial reaction. But during the visit, we can take detailed history just like face-to-face. We can ask detailed sleep hygiene questions, instructions, just like we are doing face-to-face. Also, now because of the technology, the CPAP machines, the continuous positive airway pressure machine, which is the #1 recommended treatment for sleep apnea, all these newer machines have a built-in modem, which transmits data to us in real time so that we can see how many hours of CPAP usage the patient had, if the patient still have any residual sleep apnea, if there was an air leak or not. So we have access to all those data, even though patient is not here. And in fact, there are some positive aspects that we encourage patients to do the sleep follow-up visit from their bedroom. So that we know where the CPAP machine is, what pillow they are using, if they have a laptop or a TV in the bedroom, which they shouldn't. So there are some advantages to doing televisit for sleep medicine patients.
Well, Dr. Patel from the Sneeze and Snooze Clinic, can you say again your website for those wanting to potentially take advantage of those telemedicine visits with you?
snoozeclinic.com/TV for televisit. snoozeclinic.com/TV.
All right, Dr. Patel, thank you so much for joining us and giving us a little bit of an insight to telemedicine and kind of reassuring some of our patients that might be wanting to take advantage of these new waves in healthcare. Thanks so much for joining us this morning.
Thank you. Stay safe.
Thank you.